Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Sandy and I'm the Executive Officer of the Association and a cancer survivor.
And my name is Malcolm, a former surgeon and presently chairman of the Isle of Man Anti-Cancer Association. In this podcast, we want to talk about liver cancer awareness. Most people do not realise that the liver is the largest organ in the body. It's situated in the upper part of the tummy or abdomen, on the right-hand side under our lower ribs. It's surrounded by a strong fibrous capsule and is divided into two lobes, the right one being much larger than the left. It is one of our 5 vital organs, the one that is most responsible for controlling our body's metabolism. The liver carries out some very important functions, such as producing bile, which breaks down fats so that they can be absorbed by the intestines, storing sugars and fats so they can be used for energy, producing important proteins such as albumin and proteins which help the blood to clot, and breaking down harmful substances such as alcohol and drugs so they can be passed out of the body.
The liver is also fairly unique in its structure. It has a dual blood supply with blood coming from both the heart and the gut. As an unfortunate consequence of this, it is one of the commonest sites for tumour spread from elsewhere in the body, particularly tumours originating within the abdomen, the breast, lung and skin melanomas. We call this secondary cancer or liver metastases. Most individuals who have secondary liver cancer will already have had a tumour previously diagnosed elsewhere in the body, but occasionally the disease in the liver can be the first manifestation of a primary tumour in another part of the body. The symptoms produced by secondary liver cancer are very similar to those from primary tumours of the liver.
Primary liver cancer is fairly uncommon, although it still affects a number of people each year on the island. The main cell in the liver is known as the hepatocyte, and this gives rise to the commonest tumour which develops in the liver, known as hepatocellular carcinoma. Other less common types of primary liver cancer are cholangiocarcinoma, arising from the cells lining the bile ducts, angiocarcinoma, developing from blood vessels within the liver, and rarest of all, hepatoblastoma, which occurs in very young children. So what symptoms do tumours affecting the liver give rise to? In the early stages of involvement of the liver in cancer, there are often no symptoms, and when symptoms do arise, they are frequently vague and non-specific. Symptoms from a tumour in the liver can include a yellow tinge to the skin, which is most noticeable in the whites of the eyes, called jaundice, an aching sensation or pain in the area of the liver, that is the upper right part of your abdomen, a swollen tummy caused by fluid build-up called ascites, losing your appetite and feeling full very quickly after eating, feeling sick, known as nausea and vomiting, losing weight with no obvious reason, feeling extremely tired, generally weak or unwell, or a high temperature and flu-like symptoms.
Now, there are a number of risk factors that might predispose to the development of a primary liver tumour. 3 lifestyle factors, which account for half of the cases, are obesity, smoking and high alcohol consumption. Across the world, the main risk factor is having some form of chronic hepatitis, usually a viral infection of the liver, but in the UK this is only present in 1 in 10 cases. Diabetes, cirrhosis, having some form of immune deficiency or a family history of liver cancer are other known factors. Interestingly, having a diet with a high vegetable content, eating fish or drinking coffee or green tea can reduce your risk.
Let's recap on the possible symptoms of cancer affecting the liver. Symptoms can include jaundice, which is yellow tinge of the skin, which is most noticeable in the whites of the eyes, an aching sensation or pain in the area of the liver, that is the upper right part of your abdomen, ascites, which is a swollen tummy caused by fluid build-up, losing your appetite and feeling very full after eating, nausea and vomiting, weight loss with no obvious reason, feeling extremely tired, generally weak or unwell, or a high temperature and flu-like symptoms.
So, if you're concerned about any possible symptoms, as always, the first step is to talk to your GP. Although the symptoms we have described are more commonly seen in less serious conditions, it's best to get things checked out. An early diagnosis is so important for successful treatment. If you want more information about liver cancer, you can visit the Macmillan Cancer Information Centre. You can phone them on 650 735 or go to their website, which is cancer.org.im. And another useful site is cancerresearch.uk.org. Thank you for listening.